valacyclovir or acyclovir and glucocorticoid. Evidence-based treatment for Bell's palsy. For patients with Bell's palsy or facial nerve palsy, early short-term oral glucocorticoid treatment is the mainstay of pharmacologic therapy. Antiviral medication and glucocorticoid therapy may improve results in severe acute cases. When a patient's eyes aren't completely closed, they need regular eye exams. First, let's talk about glucocorticoids. All new-onset Bell's palsy patients should be given a short-term regimen of oral glucocorticoids. Glucocorticoids have been proven to be useful in the early stages of the disease, thus treatment should begin within 3 days after the beginning of symptoms. Prednisone 60 to 80 mg per day is the recommended standard of care for a duration of 1 week. In the largest randomized trial, patients were given oral prednisolone 60 mg daily for 5 days, followed by a 5-day reduction of 10 mg each day. A 1-week regimen without a taper is easier and offers the same total dosage. There has been no increase in major side effects observed in randomized studies using glucocorticoids at previous doses. Temporary sleep disturbances, mood fluctuations, and dyspepsia are the most prevalent adverse effects. Hyperglycemia is a serious condition that should be treated with extreme caution in those who have type 2 diabetes. Some doctors frequently provide a proton pump inhibitor or H2 receptor antagonist, despite the fact that the risk of stomach ulcers in this patient group has not been well described, and prophylaxis is largely supported in patients who have other risk factors, such as concurrent use of nonsteroidal anti-inflammatory drugs. Early glucocorticoids have been shown in randomized studies to enhance results in Bell's palsy patients. An 895-patient meta-analysis from 2016 found that glucocorticoids decrease the probability of partial recovery at 6 to 12 months by 37% compared to placebo. Now let's move on antiviral therapy. Antiviral therapy is indicated for severe facial palsy. Many studies and a strong argument have failed to show that antiviral medication may improve outcomes in people with new-onset Bell's palsy. If there is a benefit, it is less and more gradual than that produced with glucocorticoids. Patients with severe facial palsy, as defined by House-Brackman grade 4 or higher, should be given oral valacyclovir or acyclovir and glucocorticoids. A short course of oral antiviral therapy is seen as having a low risk of harm while also having the potential benefit of an as yet unproven antiviral benefit in patients with a higher risk of adverse outcomes. We prescribe glucocorticoids alone in individuals with milder symptoms, although some practitioners may fairly choose to treat these patients as well with antiviral medication. In the absence of glucocorticoids, antiviral medication alone is not indicated. Valacyclovir 1000 mg 3 times a day for 1 week is our recommended antiviral treatment regimen for individuals with severe Bell's palsy. Acyclovir 400 mg 5 times a day for 10 days is an alternative to valacyclovir, but it is less convenient and has a lower bioavailability than valacyclovir. In terms of side effects, both valacyclovir and acyclovir are generally well-tolerated medications. With valacyclovir, headaches were shown to be statistically more prevalent than with placebo. Both drugs have been reported to cause agitation and hallucinations in older persons. In addition to glucocorticoids and antiviral medications, a thorough examination of eyelid closure should be performed on all patients with Bell's palsy. When the sclera is visible when the patient is requested to shut his or her eyes, careful eye care is necessary to avoid corneal injury. The cornea is more vulnerable to dryness and abrasion as a result of decreased tear production from the lacrimal gland, which is also innervated by the facial nerve, in addition to the physical exposure caused by weak eyelids. In waking hours, artificial tear drops should be used by patients 4 times a day, and even more often if necessary. Safety glasses or goggles may be used to protect the eyes from external injuries. To avoid exposure, some patients may choose to tape their eyelids shut when they are awake, using the same instructions as for sleeping. When the eye is most susceptible, such as at night and during naps, an ointment formulation of artificial tears should be used. In addition, a medical-grade waterproof clear dressing or tape may be used to properly seal the eye shut. Make sure the eyelid is fully closed beneath the dressing before proceeding. If you find this video helpful, please hit the subscribe and bell buttons. And don't forget to like and share this video. Thanks.